So we are going to start today's lecture. That will be the second class. Yesterday we have discussed about the intro, like what I can say, the type of letter we are having, the marking criteria, the timing that we will be having, and also we have discussed how to select the case notes, and we have written a letter as well. So today I'm going to discuss the different types of letter, most probably that we can have. I have tried to categorize, like different types of letter as per the writing practice that we will be having in our classes. Like previously that there was only discharge letter in the OET nursing, but from the last 1 year, we have been experiencing different types of referral letter, and even in your clinical practice that you would be able to write it down, the referral letter, when you start your job there. So I have done some category for that. There would be a type of referral letter in OET nursing when we have the diagnosis being given, or we know at least what the reason is, and accordingly we have to refer this thing to a doctor, maybe most of the time. So you being let's say emergency doctor, or just a minute please, there we have a type of referral letter when we do have the diagnosis is being given, you being a ward nurse, okay, and there is a diagnosis of XYZ thing, and now you are writing this letter to a doctor. So let's start with the first category. In the first category that we are discussing here, this is a letter of referral. We are writing this letter for the hypertension. For example, there's a patient who's having hypertension for the last XYZ year, like since 2009. The patient is having hypertension and is uncontrolled for the last, you can say, 3 to 4 visits, maybe over a period of 1 month. So what was the assessment that has been made in the hospital was, we can say, the elevated blood pressure, or most probably orthostatic hypertension, right? Most probably orthostatic hypertension, right? Anyhow, so right now we are writing this letter to the family GP. Remember that whenever you're writing this letter to a family GP, let's say, so we have to keep that one thing in mind, that the past medical history would be irrelevant. Whatever the past medical history would be irrelevant. At the moment, you can see that in this particular letter, we are writing this letter just for the, like cardiac assessment and management. So we can write just note a whole letter. Just I've written the crux of information so that you can at least understand the scenario. I will explain it. So in a letter, what you can see, there might be past medical history of the patient that has been written, and then a patient might be admitted with maybe XYZ condition. And during those admission, it was noticed that the patient is also having high blood pressure and it's not settling actually. Due to the patient positive history of hypertension that is already being known to the GP, we are writing this letter to the family GP, right, for full cardiac assessment and management, that why this hypertension is not being controlled. So we can write down the introduction in this way. I'm writing regarding your patient, let's say Mr. James Smith, a known case of hypertension who has uncontrolled blood pressure for the last 1 month for full cardiac assessment, right? Okay, this could be another way to write down the introduction. Like we can write down the introduction like that. I'm writing regarding your patient who has uncontrolled blood pressure, let's say, full stop. And then we can write in the conclusion part, in view of the above, let's say, the patient whose blood pressure is not under control, therefore he need your full cardiac assessment. So it's both of the format are fine. Some of the time people do ask this question, that should we write it down the full cardiac assessment in the introduction, or that thing should be in the introduction. So it's vice versa. It's better to write it down in the introduction part, so that like it would be very clear after reading the introduction that why this letter is being written, right? Now we have case number 2, that is your let's say, also we are writing this letter with a diagnosis to the maybe emergency doctor. This is a situation, is urgent situation. So patient is having last episode of admission, let's say on 7/4/18, with the same condition for which we are referring this patient. The patient is being managed with pericarditis, let's say, and there is a home visit. For example, at the home visit, you have seen that there is a reoccurrence of the episode. So what you can see is, to understand the scenario, is that first of all, you have to see that we have, you can say, the patient who was having pericarditis, and we can see there, he was managed by the ward nurse or the home care nurse for the pericarditis, and now there is a basically reoccurrence of that episode of pericarditis, right? So we can just write it down in this way. Thank you for seeing Mr. Andrew, who is suspected to have reoccurrence episode of pericarditis. Now, I'm not writing, let's say, further assessment, urgent assessment in the introduction. I can write it down in conclusion, for your understanding. I have written this thing for your understanding, right? I have written this thing in the not in the introduction of this letter, so that you can see the flavor of two types of introduction, right? So the first type of introduction with diagnosis, I have written the further line of action in the introduction, and the second type of diagnosis, second type of introduction, even with the same category of diagnosis being given, I have not written the further line of action over here in the introduction. I can complete in the like conclusive part, right? So today's class is just on the variety of letters for your basic understanding, that you can understand how can we write down the introduction of different types of letter. I believe that this will help you to, develop your basic understanding of the types of letter. Anyhow, so then we have a second category in the referral letter is without diagnosis. When we can see that there could be a category in OET nursing as well, there is no diagnosis is being mentioned. We just have the symptoms. For example, as you can see, there is a case. Patient is non-hypertensive, having hyperthyroidism, glaucoma, name the disease actually, and he presented on this date. At the time of presentation, he was having indigestion following evening meal, and he was tired and feeling generally weak. There was some shoulder and neck pain as well. On the very next date, 11/6/18, very next day, there was patient came again, sorry, in the state of distress, pale, sweating, complaining of persistent chest pain with high elevated blood pressure. And due to the aggressive or intensive nature of the symptom, we just called the ambulance and the patient is being transferred. So you can see there is no diagnosis is being made over here. There is no diagnosis being made. So we can write it down exactly the symptom as it is. Please do not play with the screen. We can write it down the symptom as it is. You can say in the introduction part. So we can see that I'm writing regarding Mr. Oslin, an elderly woman who is suffering from chest pain. Therefore, he has been transferred to your hospital via ambulance. So as a matter of fact, you can see that we have not made any diagnosis over here. We just have basically, we just have written the symptom. Okay, we just have written a symptom. Okay, so you can see there, this is a diagnosis. This is a letter when we can see that we have without diagnosis. We can write it down in this way. Is it clear to you? So we have discussed two of the format. The first one is a referral letter, is with a diagnosis. Okay, so then second one, we have referral letter without diagnosis, right? So we can see there are two different types of letters. The first one is without diagnosis, and second one is with diagnosis. We have discussed two things, I think, that will help you to understand like how can we write it down a letter if there is no diagnosis being given, right? Then we can see another example of without a diagnosis. There is a referral letter category, and you can see there is a patient. I just have written the crux of the information, not all the letter, for your understanding. Name is Alison Cooper. He's a year 5 student, or she's year 5 student, let's say, and she was having regular absence from school since the death of his father, and he's isolated, withdrawn, for example. So at home, even school performance getting down, mother reported attachment with father. So patient has a strong association with the father. Now we are referring due to the reason because patient is isolated at home, and her basically performance is being declining day by day in school. So we are writing this letter to a school psychologist to find out whether Alison has underlying grief or there might be some other psychological problem. So we can write it down that situation. Now you can see we can make a difference of without diagnosis. In this letter, we do have a symptom, and here this is a situation that you have to explain. So at time, in without a diagnosis, we can categorically mention sign, symptom, or investigation in the introduction part. But at time, we don't have the sign, symptoms. We do have the situation to explain. So in this letter, there is a situation that has to be explained. So I'm writing to refer Alison, who needs to be evaluated if she is having underlying grief or any other psychological problem. I can write it down, that thing, as it is in the introduction part, right? So basically, there are few categories of types of letter that we discuss without diagnosis in the OET nursing. Now, concept of discharge is as same as we have in the OET medicine, but today in this class we are just discussing about the nursing one. In the OET nursing, a conventional letter of discharge. What I'm saying is, if you are a ward nurse and you're writing to a nurse, let's say between the nurses, for example, ward nurse is writing to a community nurse or to a district nurse for further follow-up, where the line of action that is important is the further follow-up. That is I'm labeling as a conventional as mean that we do normally write between the nurses. It's I'm labeling it by the conventional letter of discharge. So if you are a ward nurse and you are discharging the patient and you are requesting to a community nurse or maybe a district nurse to provide the ongoing care to the patient, right? So this is quite simple. We have ward stay, maybe we have rehabilitation, or we have a discharge plan. So we can simply write it down in our own language. Like, I'm writing this letter of discharge regarding Mr. XYZ, who has undergone a successful right knee replacement surgery and is being discharged today for further follow-up. So this is a simple or conventional letter of discharge. So another example to the conventional letter of discharge is something that is not clear, but you have to, though it's a conventional letter of discharge, but you have to pick it up after reading the case notes. You can see there was a patient, sorry, there was a patient who was admitted due to decreased mobility, as the patient had surgical repair of her right neck of femur on this date, and there was a decreased mobility. That's why he was admitted in your hospital. In the nursing care, it was observed that her mobility or his mobility was slow, and he also had developed ulcer on right ankle, which was improved after dressing, and there was a urinary tract infection that was even managed. So after that, we can see that in the nursing care, the patient was looked after for her hygiene, and patient was helped for showering and even dressing as well. She can do self-care with permanent indwelling catheter, for example. And there was a skin integrity that was maintained with the help of deuterium dressing weekly due to ulcer. He was alert and, however, reserved. That's why we are discharging the patient. In the discharge plan, we can see that continue all sport. Let's say we can see continue all smooth. We can say um, mm, uh, continue all sport. Let's say we can see there. We have to see continue with home all sport. Let's say, and uh, we can see there for hygiene assistance with showering, dressing, wound manager rent, urinary catheter change, 6 weekly, ongoing routine care. This is a discharge plan. So who you are a charge nurse on the hospital ward where Mr. Ted Watson has resided during the hospital stay. Using the information in the case notes, what you have to do is you have to see, like will be attending Mr. Watson following her discharge. So I'm writing this letter of discharge regarding Mr. Watson, who has been managed for URTI and at the leg of right ankle. Post discharge, you need complete our home sport with follow-up care, right? Okay. So is it clear to you? At this point of time, do you want to ask any question? So, okay. So we can see that this is a letter of discharge. Basically, after this letter of discharge, you have to see, like it's a conventional letter of discharge, right? It's a conventional letter of discharge that you have to see. right? At this point of time, do you have any question? So we can see, let's say this is a letter of discharge. Now you are a ward nurse and you're writing this letter to the community nurse supervisor who has to make sure patient further follow-up as he has been managed for the UTI and the leg ulcer as well. And this is the ongoing support that need to be required, maintaining personal hygiene, assistance with showering and dressing, wound management, let's say, and unitary catheter change 6 weekly, and ongoing monitoring and care. This is the discharge plan that has to be ensured by the what we can say your community nurse supervisor. She has to arrange a community nurse, right? Now there are different categories of letter of request. So this is one of the unique kind of letters that has been associated with your OET nursing. So first of all, try to understand letter to occupational therapist, let's say, letter to physiotherapist, let's say letter to social worker, letter for eligibility of pension care, a letter for home placement and genetic review. Some of these letter would be explained in the class now. So basically, if we are writing a referral letter or a discharge letter, this letter of request can be in the category of referral or can be in the category of discharge. What I mean by that can be in the category is your patient who is being, I would say, referred, right, directly to the occupational therapist from your, let's say, from your ward, let's say, or maybe from your nursing home, let's say. This is not, you can, or you are a home care nurse, for example. So whatever the scenario is, whatever your role will be, but either we are directly referring this patient due to any reason, or maybe it's a discharge, but after discharge, you need that part of the services. It's kind of a split to your conventional discharge, let's say. We can see there, now we have categorized few of the types over here. Now we are writing a letter of discharge. It's unconventional, I would say. Unconventional means the second end of the letter is different, the different services that we do normally require. So here, this is a letter of request. We need nursing assistance. Remember that it's not only a nurse, but it's a complete assistance that would be required. We can say it's a nursing assistance. Might include different thing in the nursing assistance, or not only the not only the need of nurse, but also other requirement that has to be required for the patient. Let's say in this case, there's a patient who conceived triplets via IVF by C-section, right? And the patient need daily wound dressing arranged with the flying doctor. This is a service actually. Flying doctor is a service. Such a need to be removed by doctor in 1 week if infection clears up. Right, light exercise and diet. Some assistance with the babies and housework, preferably live in child care assistance for first 3 months. So basically, you can see there the nursing assistance being required because the patient will be living in the child care assistance for the first 3 months. Mother craft nurse to assist with breastfeeding. So basically, mother need to be like counseled or educated for the breastfeeding. Now we can see I'm writing regarding Mr. Chapman. Sorry, before we can read the case notes, write a letter of referral. Write a letter of referral to the nursing coordinator. Let's say write a letter of referral to the nursing coordinator. Uh, you can see at the flying doctor service. This is a service, commercial road port, whatever, explaining that Mr. Champman will need full assistance with the babies and her 5-year-old son for some time. So we are fortunate enough that in this letter, we do have written clearly that why we are writing this letter. So we can just have to write it down clearly. But it's a kind of letter student get confused when you see a lot of thing in the letter ongoing. So we can simply write down, I'm writing Mr. Champman, who has conceived triplets via C-section. She would therefore require full assistance for her new babies and also for her 5-year-old son, right? So you can see this is a letter of discharge in the unconventional category when we are requesting to the nursing assistant post discharge. So you can see it's a kind of request letter to the nursing assistant post discharge. Now we can also have a letter of maybe referral or transfer or discharge in any category. But if we are changing the facility, this is just an example to the hospice care. There's a possibility that you can transfer this patient from ward to the emergency department being a nurse. There's a possibility that you can transfer this patient to the quarantine facility. There's a possibility that you can transfer this patient from one nursing home to other nursing home. So the concept remains the same for the letter of transfer. There could be one-way transfer, there could be two-way transfer. You have to understand the basic understanding. So basically, if you can see this case, there was a patient who had this laparoscopy as it was of cancer, and then like it was in a metastatic stage. So in simple word, the patient was at terminal stage of cancer and with low prognosis. At the time when we are referring this patient or transferring this patient, the patient was quite weak, disoriented, however, pain-free. He is not tolerating the solid food. He's just able to take the liquids. And he requested, or she requested, whatever the patient gender will be, to have the apple juice or lemonade. Or social worker basically advised the patient family that she should be shifted to the hospice care. So you can see this is the writing task using information in the case notes. Write a letter to the director of nursing, not director of nursing of the palliative care home, and introduce this patient. Use this relevant case notes giving her background, medical history, and treatment required. So basically, why are we writing this letter? We are writing this letter to acquire a place in the nursing home. So we can just write it down in this way. I'm writing on the advice of social worker regarding Miss XYZ, a terminally ill patient who has been under our care for the treatment of cancer. Hence, she would require a place in your hospice care. Or also, I can just skip this part and I can write it down the grade in the conclusion part, right? Somewhere in the conclusion part. So basically, you can see there, we can just write it down either over here or maybe down the grade in the conclusion part, right? So, yes, you can see there when we are transferring the patient to the hospice care, we can just write it down in this way. I'm writing on the advice of social worker regarding Mr. XYZ, a terminally ill patient who has been under our care for the treatment of cancer. Hence, he would require a place in your hospice care, right? So just this is not a complete letter. This is just a crux of the information for your understanding to give you exposure toward the different types of letter, right? To give you exposure toward the different type of letter. Now followed by the you can say request for the dietary advice. Now we can see there, this is a letter of transfer or maybe a discharge letter most of the time, or it can be in the category of referral. So what we can see there, you have been a nurse, let's say, or you are writing this letter to the community information section of the Heart Foundation. So this kind of letter, when we need a dietary advice, can be written to the dietitian. As you can see, the patient was having some heart condition. That's why now we are writing this letter to the Heart Foundation so that they can advise on the low fat diet. So you can read it. For better understanding, this was the patient which had this procedure being done. He was recovering normally on low-fat diet, walking well, wounds healing, routine visit from social worker, discharge plan, home returning home, appointment made for the local GP, the local physiotherapist for rehabilitation exercises program. Now you can see there, and we just need advice on the low-fat diet, and we are writing this letter on the behalf of the patient, let's say. So we can just write it down in the behalf of the patient. We can just write it down, the information that is being required. So I'm writing with regard to Mr. XYZ, a 53-year-old man who has requested advice on low-fat dietary guideline and healthy simple recipes after his discharge, right? So you can see that patient has requested advice on low-fat dietary guideline and health simple recipes. We can write it down the same thing in the introduction. People get confused, although it's quite simple. It's written in the writing task, right? So we just have to phrase this thing in your own language into the introduction part. As the patient has requested to have a low-fat diet advice and healthy, simple recipes that he can, like incorporate in his daily life with reference to his heart condition. For that reason, we are writing this letter to the, we can say, Heart Foundation, right? Anyhow, so this letter, let's say, if I can change the writing task, this can letter be can be written simply to the dietitian, write a letter to the dietitian, and request him to plan a low-fat diet for the patient, like that. So he will be looking for the things that are related to diet, even sedentary lifestyle, even the food intake, whatever it is. Even if there's the dentures of the patient, it's also important. Even like say BMI of the patient will also be important. Even diabetes, hypertension, that can be affected by the intake of the food. These information would be important for the dietitian, but we have to see the priority. As let's say, if the patient is fond of eating, let's say, sweet diet, is more important than writing a diabetes to a dietitian, right? So according to the need of the dietitian, we have to see, like we have to write it down things according to the need of the dietitian, right? Anyhow, so you can see that we can have another type of letter. It's a referral letter, or mostly it's a referral plus discharge letter. So age care assessment normally is being done for 2 to 3 reasons. First and foremost is age care assessment is being done when the patient is being discharged from your hospital and he has to go back to his home. So basically, a home care nurse will assess the patient requirement, and he will make sure that the same thing that is being advised by the doctor has to be done at home. Age care assessment has also need to be done when you are moving the patient from home to nursing home. Then we can see that what are the likes and dislikes, what are the hobbies of the patient, or the medicine that he has been taking, any ongoing condition the patient is having. Basically, you can see there, these things should be written in the age care home. So here you can see that you are one of the nurse from this agency. You visited the patient for the first time from this hospital, and the patient is being discharged. Their patient had a successful procedure, and there was no complication at the time of discharge. And you have been looking after the patient, and but on November 24, your role has been finished. Now, however, they need to be assessed for ongoing assistance in their home and their house or household chores on a daily basis. For that reason, we need an age care assessment team to assess them. So we can write it down in this way. I'm writing to request age care assistance for Mr. XYZ. Let's say I'm writing to assess, let's say, age care assistance for Mr. XYZ. Let's say, who is recovering from a malignant melanoma in his left shoulder, right? So we can just write it down this as an introduction. For the age care assessment, the concept I've explained you, age care assessment has to be done when you are transferring the patient from home to the nursing home, or maybe when the patient is being treated for something in the hospital, the ward. Now you want to refer him back. However, due to the patient limitation or patient dependencies, you have to conduct the age care assessment, or as the name indicate, is being mostly done for the elderly patient according to their requirement. If they are dependent on something, if they are handicapped, if they cannot take their medication, or if there is having some ongoing condition that is, so you just have to perform this age care assessment, so that most probably a home care nurse has to look after the patient after the age care assessment has been done, right? Anyhow, so if the patient is moving back to home, the age care assessment will perform their assessment, and they're being subjected to a district nurse, to a community nurse, so that she will make sure to follow this thing, right? This is a specialized field. Or if the patient is moving to the nursing home, again, the age care assessment team will assess the patient, like ongoing diseases, the medicine that patient has been taking, or in anything that patient likes or dislike, patient social like behavior, or if he was how much interested in like communicating socially or whatever. So it has to be done by the age care assessment team in these different scenarios that I explained you. Anyhow, so afterward, we have the request for pension care. Again, it's a job of the nursing care that they have to, like help the patient out. It's a support mechanism. Like nursing staff are mostly engaged in the support mechanism in the healthcare. That's why this is called as a backbone of the healthcare, because they are in the support of the patient in every and each scenario and circumstances. So here, in this regard, let's say whatever the scenario is, the patient is being discharged from the hospital mostly, or the patient was treated for something, and now you are referring this patient. Now maybe there was a patient, for example, in this case, the patient was, you can say he was veteran, let's say, from the army. So you can see there, we are writing this letter to the Department of Veteran Affairs, let's say, and who will be responsible for granting the pension to the patient if the patient is eligible. So they have given a brief of a background for your understanding. There was a patient who had successful surgery. Previously, he never applied for pension because he was so much independent on his earning. However, due to his loss in his investment, her wife is quite concerned about how they would be able to manage, because there were some dependencies they were having, and even they cannot commute. They just have to rely on the Uber or taxi. That is even quite expensive. And the point is, it cannot be done on phone because her wife cannot hear things clearly, and she's becoming deaf day by day. So that's the reason it has to be done on site at person. So you can see there, we are writing this letter to the Department of Veteran Affairs. So in the regarding part, you just write it down: RETVA pension care for Mr. and Mrs. XYZ. We can write it down in the regarding part, DVA, as let's say for Mr. and Mrs. XYZ. So you can see I'm writing to request a home visit by Department of Veteran Staff to Mr. Jim and his wife, but XYZ. Or we can just write on Mr. and Mrs. XYZ to assess their eligibility for DVA pension and or other assistance that your department could provide, right? So basically, we have introduced the scenario. There's a patient. It's better not to write it down, but as it's written in the, let's say, if it's written in the conclusion, so we can write it down DVA, like Department of Veteran Affairs. We can write it down once in the letter, like full, and then we can write in bracket the abbreviation. Then you can repeat it, DVA. Otherwise, it's better to write in full form, right? Anyhow, so I'm writing to request a home visit by Department of Veteran Affairs staff to, to Department of Veteran Affairs regarding the availability of pension and home health, right? So just a minute, please. So we have discussed about, let's say, the transfer to hospice care, and we also discussed about the transfer for the nursing home and transfer to the, you can say, let's say transfer to the nursing home is as same as when we are transferring the patient to the new nursing home, right? Okay, so I can see there, I can write it down in this way. I'm transferring Mr. Mark to your hospice care as he's on the terminal stage of cancer and he needs further palliative care. Okay, so then we also have a letter of education, and letter of education by concept, you being a school nurse and you're writing a letter to a parent for outbreak of some disease, right? So basically, you being school nurse and you're writing this letter to a parent or community of outbreak of some disease, right? Outbreak of some disease, right? So we can write it down, a letter, being a community nurse, to a general practitioner, community nurse, to a local public on outbreak of some disease, right? So we can just write it down in this way. So outbreak of chickenpox, let's say outbreak of COVID-19, and so on, right? Then we have a letter of information. We are writing this letter to the ministry. Then it's something that we have to see if we are writing letter to a ministry. So at this point of time, if you have any question, as we discuss with you people, whenever we have the writing task, you should go to the bottommost part. Here, in the writing task, it's been written using information in the case note. Write a letter to the nurse in charge of the district nursing service outlining Mrs. Martin's situation and anticipated needs following her return home tomorrow. So write a letter to the nursing in charge district nurse. So basically, the reason of writing that has been explained in the writing task is to explain the needs and requirement of the patient back to home. So in the discharge plan, we always see the last part. In the discharge plan, you can see that we have a discharge plan regarding dietary instruction, regarding physiotherapy. In other weeks, as we mentioned about the, like to monitor bruising side, to adhere with the medication, a regular family visit. And you can also see like home visit from the community health district nurse, monitor to adherence, post-operative medication, exercise, dietary regime, and so on. Now we have regular monitor by doctor, dietitian, physiotherapist, and we are also having danger of social isolation. So at least we have an idea like what the situation is. Now we can see in the nursing management, patient was recovering normally. He was tolerating light diet and fluids. There was a bruising at the catheter insertion site. However, there was no sign of infection. Bleeding noted post-procedure. Patient anxious about return home. Not sure if you would be able to cope up or not. Now, accordingly, you have to see, we can say the case from top to bottom. Now we can see the first page. You are a ward nurse in this unit and his patient is being discharged. So this is the basic details of the patient. You can see that in nursing letter of discharge, socioeconomic details are important, but we have to see that where should we write it down. Here, the patient never married, no children, live in own house, Greenville, financially independent, 3 siblings, let's say whatever. Contact with family is intermittent, like it's not that much, he's not that much in contact with the patient. She does not drive, and this is the food intake of the patient post pre-surgery, and the diagnosis of the patient and the surgery. The medical information is being written. We just have to see as the patient was insured for the medicine compliance. So we just have to write it down, this information with reference to medicine, right? A sedentary lifestyle can be explained. And family history, not need to mention about the family history. Hearing loss can be written. Hearing loss can be written anyhow. So then you can see that there is a routine post-operative recovery. However, there was bruising. So it can be written area-wise. Area-wise mean after writing introduction, we can just write down the nursing management and then separately discharge plan. Or in the nursing management, we can pick an area, let's say post-operatively, she is recovering well. However, there is infection at the site of catheter insertion. Sorry, there is bruising at the site of catheter insertion that need to be monitored in order to avoid any chances of infection. Then we can see that patient has been tolerating light diet and fluids. Therefore, I would appreciate if you consult her dietitian to plan her dietary regime, as the patient can tolerate, let's say, a light diet and fluids. So I would appreciate if you could make sure to take advice from the dietitian for low calorie, low cholesterol, gluten-free, however, high protein intake diet after dietitian advice. Please make sure that she should be given small meal or snacks along with addition to drink plenty of fluids. Previously, she was on meal and wheel, let's say. So like that, you can write it down, okay? Then we can write it down about the physiotherapy. And you can also write down about the sedentary lifestyle over here. Then you can write down about the social the medical history, that she has been taking blah blah medicine. Therefore, I would appreciate if you could ensure, if you could if you could, you can say, ensure that district nurse helps the patient for her medicine compliance. Then we can write it down about the family status and the danger of social isolation. Anyhow, this could be a format that has to be followed for this letter. I will share in. Yes, this was that was missing actually. The main concern this letter is to request the social worker to support the patient so that they can have a normal life. There's a patient who had this cabbage surgery. Now, these details are very important than the medical history. As somebody has asked question, first to write down social history or medical history. To answer the question, even there's a cabbage history and follow-up include, let's say, a lot of information such as giving up smoking and maybe the dietary guidelines, the deep breathing exercises. But you can see that I'm writing to request your social services for Mr. XYZ in order to help him resume his normal life. So now social history will be more important than the medical history in this specific case. So as per case, this is a letter to a social worker so that he can help the patient to start his normal life after this surgery, right? So this is one of the kind of letter that was missing. I have not discussed that, sorry for that. Anyhow.